What's most broken is our inability to ask good questions and then really sit quietly and listen carefully. I wish I could say it's just one thing, but that's the whole point. It's not just one thing. It is the patient journey. It is the patient experience. It's the process. So everything from, when they first come in the door, how they're treated, how they're handled, everything, how the front and the back relate to each other, how they
Hmm.
communicate with each other, the handoff, particularly. I spend a lot of time talking about patient handoffs. So I want that patient in that practice to feel like they're special, like they're king or queen for the day. And I've had patients say this when I went to that office. I know there were other patients there, but I just felt like I was the only one because I never felt alone or unattended. So those handoffs, how we answer patient questions, it really is,
The
Gary.
whole
I wish
thing.
I could
Yeah.
say it's one
So
magic
which
bullet,
which
but it
area which
really is the
areas
process.
which area is the most broken? Would you say when you walk into a practice that you see over and over and over again that people just miss?
Um, just answering patient questions, and it's not any one particular. It's not always the front desk. It's not always the back. It's in the communication.
The
What's most
communication.
broken is that we think that patient education is the answer. That the more we talk, the more results we're going to get. What's most broken is our inability to ask good questions and then really sit quietly and listen carefully, not to be afraid of the silence as
Mm.
our patients are going through the thinking process of trying to answer our questions. So, the value of open ended questions is when you ask somebody, so I've just explained to you why you need a crown. Do you have any questions? No,
Yeah.
because most people are afraid to ask questions or embarrassed to ask questions or don't know what question to ask. But if you
Yeah.
ask an open ended question like, what questions do you have for me? It requires a little bit of thought, and we need to give our patients time to think about their answers. So,